Hello, it's John Gonzalez from the Dizziness, Balance and Concussion Centre, and today's blog's all about post-concussion syndrome. We're going to kind of look at some of the theories behind it, of what causes it, and some of the treatment options and things there. As ever, it's a guide. It's given with the best intentions. The education, I do hope, is useful to you, but it's not a substitute for going and seeing a concussion therapist or someone who's a specialist in concussion. Please don't take any chances and things like that, but equally it should give you some idea of what concussion therapists are talking about, and equally some questions to ask and things like this. Equally, it's an area that's being researched all the time, so depending on when you're watching this, the research may have changed, and equally the views in it may have changed and things like that as well. So, what is it and what causes it? There are two main classifications for post-concussion syndrome. One international system classes it as having three concussion symptoms lasting longer than 4 weeks. The other classes it as 3 symptoms which is leading to social problems beyond 3 months. Big discrepancies there and big differences there. Generally speaking, a lot of medical practitioners just accept that it's concussion symptoms lasting longer than 4 weeks. Again, trying not to focus on a few concussion symptoms, whichever symptoms you're experiencing, and those lasting longer than 4 weeks. We think that it affects between 30 and 40% of cases. Now that's, again, new research is coming out that says actually underlying issues might be longer lasting, certainly with the vestibular processes and reflexes and things, and in younger children where it may be lasting on a lower level for a lot longer. So again, there's a lot of research happening in that area. For some people it can be permanent. This is more prevalent in females over 40, with the research suggests and found, but again it could be for anyone. Thankfully, we normally find that if people are treated and treated sooner, then that shouldn't be the case. It limits the likeliness of that happening. So with that in mind, we generally start treating people as though they've got post-concussion syndrome about 2 weeks. This helps stop people going into longer term issues. I'm not alone in that either, so it's something to try and get on top of it as quickly as we can. That's a general list of concussion symptoms. Obviously it's different for everyone, and people can have 1, 2, 3, however many of each different one. Always remember that after a concussion, only because these symptoms go does not mean that you've recovered from your concussion. The brain may still need some time to heal there. So what causes post-concussion syndrome in particular? It's not fully known. We don't know. The concussion occurs. Why doesn't it recover along the same lines as everybody else? As I say, we don't fully know. We've got 5 main theories at present. I don't think they'll ever get it down to one reason and one thing alone. It seems to be quite a multifaceted condition. There'll always be some aspects of one for somebody and another for somebody else, and equally there'll be a lot of crossover, and there might be 1, 2, 3, 4 issues present at any one time. So anyway, looking at the 5 theories, the first one we come to is blood flow abnormality after a brain trauma. That's basically the blood flow doesn't go back to the previous levels. It doesn't perfuse through the brain as it usually did, or we think it might be that the brain and the body isn't able to cope with it as well as it used to previously. And basically what happens is that when there's more demand for this in exercise and things like this, it leads to symptoms. So that's one of the theories there. The second one is basically metabolic inflammatory or hormonal issues. With the metabolic one, basically the energy systems haven't got back to normal after the concussion. There is some research for this, but it's not as strong a case now as previously thought. The inflammatory issue would be that basically there's been some inflammation happening on a local level, which is persistent. Now the problem with inflammation is that once it starts, it can then be self-perpetuating, so the inflammation leads to more inflammation and so on and so forth until we kind of get on top of it. Something that's coming more to light recently are hormonal issues. So research is starting to show that in some cases when we've had the concussion, the pituitary gland has been damaged as well, and that's led to hormonal imbalances and things like this, which may be suggestive of prolonged symptoms for some people as well. One of the most common causes of post-concussion syndrome is a vestibular motor dysfunction. Something's gone awry with the vestibular system, something's gone awry with the vision centres, and how they're processing what we see and things like this, and it's misinformation into the brain. We group them together because it's quite hard to distinguish, but there are ways to do that, but that's a very, very common one. Another very common one is cervical spine dysfunction. So basically, this is the crossover between whiplash and concussion. The forces to have a concussion are certainly high enough to create a whiplash as well. And basically, it's like people who have chronic whiplash and chronic headaches and things like this after a whiplash, that can be a process that's occurring here as well. So we need to look at that. On top of all of this, psychological issues. Now, some people might be absolutely fine before they had a concussion, but then it's left them with anxiety, depression, things like this. Normally that's as a result of the symptoms and things there. Unfortunately, anxieties and depressions make everything worse as well, so it's kind of this extra layer on top, and it's something that we do need to certainly address and certainly be aware of. It's rare that this is the main driving cause, in my experience, that anxiety is causing everything, but I do get a lot of doctors saying that your symptoms are down to anxiety or depression. Often what I find is that the anxiety and depression comes about as a result of the symptoms and is making the symptoms worse rather than being the cause of the symptoms. Now, that doesn't make it any less a condition to consider or any less of an issue that we need to look at. It's just that we need to bear that in mind and not just dismiss all the other symptoms, which I think sometimes happens with some doctors in my experience. So how do we treat it? Well, it all comes through a good assessment, and that's the really key thing. We find out where the deficiencies are, and then we've always got to bear in mind it's normally more than one in my experience. Certainly the psychological issues on top of whatever we've got, it is very, very common, but it might be a case that someone's got a vestibular issue, they've got a neck issue, they've got blood flow abnormalities, and then they've got some anxieties on top of all of that, and who can blame them? So it's finding out where these issues are. We still need to rule out serious pathology. It may have been missed. Also, for peace of mind, a lot of people, if they've had symptoms going on for 3 months, 6 months, a year, things like this, straight away your mind jumps to it must be something more serious than just a concussion, and things like this. Now, that's not to do down concussions, but we start to think it must be something more drastic. So we need to make sure that that's all cleared, and that helps to put a lot of people's minds at rest as well, certainly if that's not been cleared in the past. So looking at the individual things, so the blood flow abnormalities, we know that exercise therapy can help to resolve these. The key is pitching it at the right level. If we exercise too hard too soon, that can actually delay recovery. It basically stirs up all the symptoms and makes things happen there. So we need to find the threshold that people can exercise at, and then we can tell them what to do appropriately. And that's the key thing to the good assessment, is getting them in, doing the right test on them, seeing what they can cope with, and then exercising at that level, and then we can retest and adjust that accordingly as we go along. For the metabolic, inflammatory and hormonal issues, we've found, or what the research has found, that dietary management is more effective than medical management in this case, so we need to look at that. Often that's more effective again if people have had a very poor diet previously or historically. There can be chronic inflammation there as well from that. So it's looking at those things as well, and looking at it as somebody as a whole rather than just as this individual incident. The hormonal issues, that might require some more blood tests and more hormonal tests and things like this, and looking at that. Exercise alongside this, certainly with inflammation and metabolic, we know helps as well. Again, it's pitching the exercise at the right level, and that's the important thing. The vestibular oculomotor dysfunction, really it's vestibular rehabilitation, and potentially vision therapy if that's not helping. So going to see a vestibular therapist, going to see someone who treats all of these issues and looks at those on a regular basis is important. It looks very simple, vestibular rehabilitation. It's a very complex field in itself and many different causes. That's why ideally going to see someone who knows what they're on about is important. Cervical spine dysfunction, physiotherapy, chiropractic potentially, things like this. Manual therapy is exercise postural advice, just as it says there, just as we would treat a normal whiplash and get on top of that. So for any physio worth the salt, any chiro worth the salt, that's quite an easy and regular thing to do. Often this is alongside other things, so normally your concussion therapist will be able to do that alongside everything else as well, because they'll have training in that. The psychological aspect, often people respond very well straight away, because if they've got someone or they see someone who knows what they're on about or understands what they're going through, that helps straight away. But so having the reassurance, having the education and things like this can really help, but at times it needs more intervention than that. So it might be a case that we need counselling, we might need medications and things like this to get on top of anxieties alongside with the treatments and things like this as well. So it all depends on who it is, who they are, what level they're at. There are some techniques to really help with anxiety and relaxation and things which help, but again, it depends who you are as to how you respond and whether that's sufficient enough or not. So we've always got to be open to referring on or working with the health professionals to get on top of these things. How long you've had the symptoms and condition as well will have a major impact on that as well. So it's been a very brief overview of this. I'm more than happy to talk to people about their individual cases and things like this. You can always get in touch with me at info@concussiontherapy.co.uk. Go to the webpage concussiontherapy.co.uk or dizzinestherapy.co.uk, and you can always give me a call from there and things like this. Equally, our partners in Canada, completeconcussions.com, a great resource as well, and got a lot of good information there. But if you've got any doubts, please get in touch. I'm more than happy to have a chat with anybody, and hopefully we can help. Hope you found that useful. It's been a whistle-stop tour to a complicated issue, but hopefully it gives you a bit of help there. Thank you very much.